Good morning, everybody. Dr. Anita here from Mylan Family Chiropractic Center, riding in the car with the Chiro. So today's topic, we're going to talk about, should you see a chiropractor after you've had spine surgery? Whether you're talking about spine surgery in the lower back, in the mid back, which is fairly rare, or surgery in the neck, whether they've gone through the front of your neck or the back of your neck, whether they've put screws, plates, plastic discs, fill-in discs, laminectomies, hemilaminectomies, bilateral laminectomies, fusions, whatever you want to call them, whatever it was called when you went and had it done. And the reason why I bring it up is I would say probably once a week we have somebody new who comes into the practice who's had some kind of history of previous surgery, previous surgical intervention. Whether it was most recent, whether it was years and years ago, whether it was as a result of a car accident, whether it was a result of a work injury, whether it was as a result of long-term spine injuries, lower back, neck injuries, whatever it may be, they come in typically weekly to find out what can chiropractic do for them. Well, the first question is, why do people need to go to the chiropractor after they've had surgery? Well, the bottom line is this. When you've had surgery, and I'm going to assume, and I typically do assume, that when people have had spine surgery, it's because it was in their best interest. They had some kind of major issue going on at their spinal cord level, which could cause some severe damage to the nerve root and or spinal cord. And that could be long-term devastating effect for the rest of their lives. Never mind the long-term effect of, God forbid, paralysis. So I'm going to assume that the surgeons did exactly what they needed to do based on what the patient presented with, right? What I do find, though, is instability all the time post-surgically. And why is that? Well, when you go in and you fuse a spine, whether it's the lower back, mid-back, or neck, excuse me, what happens is you create an instability because you've fused off an area of the spine that wasn't designed to be fused, and you've lost mobility at that area of the spine. So what happens is the segment above and below that area of the spine has to work harder than it was ever designed to work before because of that fusion. So something needs to be done in order to maintain that spine in mobility, or that spine's going to fail again. And they actually have a diagnosis called failed back surgery syndrome. And what that means is not that the surgery or the surgeon did a bad job. What happens is the area above or below that surgical intervention has failed, meaning it's gotten so weak because nothing was done to stabilize those areas so that they don't fail, and they therefore fail. And I've had many, many folks in my career come in with 2, 3, sometimes 4 surgical interventions in the same area, just moving up segment to segment to segment, or moving down segment to segment to segment. Well, while the surgery stabilizes that unstable segment, what it does is it creates undue stress on the mechanics of the spine long term. And it leads to degenerative arthritis, or what we call osteoarthritis, in the segments above and or below that area of the spine. And eventually it fails, and that degeneration winds up in and around a nerve root and the spinal cord, prompting another surgical intervention. Well, where does chiropractic come in? Well, in my clinical experience over the last going on 28 years, I have found that if you can maintain the spine and nervous system chiropractically by adjusting around that surgical intervention, you keep that segment from further failure. Meaning, you stop degenerative arthritis from happening. You keep those segments mobile so that the nerve roots don't get impinged upon, so that the disc does not break down, and that person's spine remains as healthy as it can be post-surgically. So when you're sitting in your circle of your family or your work people or your friends, and people are talking about, yeah, it's spine surgery, I can't go to the chiropractor, or they're saying that, yeah, I had spine surgery and my surgeon told me never to go to the chiropractor, don't listen to that. Why? Because we get great results working on people post-surgically. I can think of 3 people right now off the top of my head who've come in who were told probably don't go to the chiropractor. One guy came in after surgery who couldn't even walk. And he had to have surgery. His clinical case presented he needed surgery, but he was riddled with arthritis. And he went in and had surgery, and the surgeon did the best he could with what he had to work with. But the reality was he wasn't really that much better. While he didn't have shooting pain down his butt into his leg, as in sciatica, he couldn't walk. So what good was the surgery that he didn't have pain down his butt and leg? He still couldn't go out and walk and live his life. Hey, CK, Jarima, welcome. So my take on that is within a month and a half to 2 months, this guy was out walking a mile a day, a mile. And post-surgically, he couldn't walk from the bedroom to the bathroom or from the living room to the bathroom. So don't be afraid to see a chiropractor if you've had to have spinal surgery. We're going to go in and assume you needed the surgical intervention. But then as a chiropractor, we're going to evaluate your spine and make sure that we do everything we can so that your spine is working as best as it can with the effects of post-surgical syndrome going on. Meaning, we don't want your spine to break down. We want to make sure that your body's performing at its very best after surgery, and so that we can help you avoid surgical intervention in your spine for the rest of your life by maintaining your spine and nervous system through chiropractic and exercise. There is no panacea. Chiropractic isn't the only answer. I'm not here to tell you that. I'm here to tell you that there is a myriad of things that you can do. And I always tell my patients that they need to exercise. You can see by my looks, I just got done exercising. Why? Because it allows me to be at my best. It gives me that energy boost. It keeps my spine as mobile as possible. Hey, Linda. So it's really, really important for you to hear the message that when you do have spine surgery, whether it's in the neck, mid-back, or lower back, which is the most common, you can still see the chiropractor. You can still have success seeing a chiropractor. You don't have to be destined to having further spinal surgeries down the road. You don't have to be destined to have degenerative arthritis or osteoarthritis as a result of having spine surgery because of whatever created the need for that surgery in the first place. So you don't have to live like that. Chiropractic has the answer. We're going to check your spine and nervous system and keep it functioning at its very best in spite of the surgical intervention. And please know this. If you've had surgery, there is nothing I'm going to do as a chiropractor to dislodge the nuts, the bolts, the braces. There is nothing I'm going to do that's going to disrupt what happened during that surgical intervention. So it is completely safe. And it is extremely effective to see the chiropractor post-surgically. If your surgeon tells you don't go to the chiropractor, I'm sad to say your surgeon has not read the research and the success that chiropractors have all over the world in taking care of folks post-surgically. And I'm here to tell you, as a chiropractor, I refer people for spine surgery. Yes, I do. Because there are cases where I can't get the results that I need. And it's in the best interest of our patients for you to go and get a surgical consult and possibly surgical intervention. And if I don't get success in my practice within a month, some kind of monitorable success where we're getting mobility, decreased pain, all kinds of things. If we don't see something in a month, I'm missing the boat here. And I don't have all the answers for everybody. And so I typically send you out for an orthopedic or neurologic consult so that we can work together for the best interest of you and your spine and nervous system so that you get the very best care possible for you. So again, don't be afraid to see the chiropractor if you had surgical intervention. If you're considering, geez, I think I need surgery, my back, my spine, my neck, the numbness into my butt legs, the numbness into my arm and hands is so unbearable. Please consider seeing the chiropractor first before you have surgical intervention, because 8 out of 10 times, truly, chiropractic can have success and help you avoid surgical intervention. So this is Dr. Anita with Mylon Family Chiropractic, riding in the car with the chiro, checking out. I'll see you on the next ride. Have a great day. And if you have any thoughts or questions you want me to entertain on these weekly riding in the car with the chiro, please drop me a message. I'd love to hear what you'd like to talk about because I'd love to share my insight on that. Have a fabulous Thursday. See you next week.